We have Philip from Refugee Health Workforce.
Imagine you are Aisha, a mother and a nurse from Aleppo, forced to flee in 2013 amid airstrikes. Fast forward to today, and Aisha has been sitting idly in the refugee camp in Jordan for 5 years, unable to work because no one believes she's a nurse because she doesn't have credentials. They were left behind and destroyed. Thousands of demoralized healthcare workers like Aisha exist, unable to work despite having the skills. And the tragic irony of the situation is that the World Health Organization estimates between 13 and 18 million lacking healthcare workers globally by 2035. Working is a way back for Aisha into a new life for her and her family. So how do we support her? We believe that restoring healthcare credentials is the key step in this situation. We propose a three-pronged approach. One, a rigorous evaluation procedure to verify basic nursing knowledge. Two, a certificate that provides international comparability. And three, a means of storing that certificate digitally secured through the blockchain. Our partners bridge the critical gap between content and technology. CGFNS is the worldwide expert on credentials analysis, knowledge-based testing, and international comparability. ProCivis is a technology provider that has developed a digital identity app based on the blockchain, tested and trusted by the Swiss government already. And finally, we're in talks with local implementing partners like the UNHCR in Jordan to actually reach the refugees. Okay, so how would this work? Aisha would provide whatever evidence she has of her employment, her licensure, and her education to CGFNS, who forensically check this. If she has no evidence, CGFNS will look for secondary evidence and issue a basic nursing exam, a competency-based basic nursing exam. And on the basis of all of this, CGFNS will then issue a credentials evaluation report and and give this to Aisha. And this credentials evaluation report will provide everybody internationally with the certainty of educational standards. This certificate is stored on her identity app. The identity app is a secure wallet for storing credentials and identity attributes. CGFNS cryptographically signs the certificate, links it to the identity app, and that's it. Aisha has this certificate and can share it with any third party, and the third party has 100% certainty that this came from CGFNS. Our ambition is to accelerate the training, recruitment, and decision support of refugee frontline health workers. We believe that blockchain technology, if applied right, can expand the availability of effective, affordable healthcare, community health services, and increase the mobility
Thank you, Philip.
of healthcare professionals.
Questions? Marika?
Thank you very much. And I think this is the sort of solution that everyone would want to see work in practice. Some boring practical question. It seems to be quite a cost-intensive way of confirming all this information. How do you think this would be costed, financed, this approach?
That's a tough question. Thank you. Probably it is expensive, but it's less expensive than starting from scratch and educating somebody fresh. Given the global lack of healthcare workers, this recertification and restoring of healthcare credentials is probably a much cheaper way than educating new people. That's one. Number two, the major cost component is the comparability of education standards between different countries. But once you do that, that's done, right? And the marginal cost of evaluating each person, of course, is an individual approach. Sometimes they have records, sometimes they don't have records. And so it really varies. As to funding, we're looking for funding at this point in time. We believe it's going to cost between 700 and 900,000 for a small pilot. And once we've set that up, we can hopefully roll this out at a much cheaper unit cost to the rest.
Cheryl?
Thank you, Philip. We had, I think, a lot of enthusiasm yesterday in the group about this this fantastic solution. I'm wondering if you can elaborate, though, on the tech side. So, how are technologies enabling this solution, and the new technologies we have today enabling the solution that we might not have before?
So, blockchain is a buzzword, and very few people actually understand it, myself partially included. That's why we work with Procivis. Procivis has something, it's a smartphone-based digital identity app. So it's an app that stores the data locally. And in this case, CGFNS cryptographically signs the certificate, which means there's a private key and a public key, and puts the hash, which is an output of a hashing function, that's what it's called, on the blockchain. This then you could put it on any blockchain. There's the Bitcoin blockchain, the Ethereum blockchain. There are lots of different blockchains out there. And that provides pretty much 100% certainty that with the right private key, Aisha can prove to any third party that this is actually issued by CGFNS. That didn't exist. We used to work with centralized databases that were prone to hacking and where your data potentially fell into the wrong hands. In this case, the identity.
Thank you.